Hello, my name is Sepideh Hanjani. I'm the Stroke Council Vice Chair and a member of the ISC Program Committee. It's my pleasure today to be here to speak with the primary investigator of the Rescue BT trial, Dr. Zhongming Qiu. Dr. Qiu, if I could ask you to introduce yourself and tell us a little bit about the purpose of the trial.
Hi, good morning, Dr. Hanjani. I'm Dr. Zhongming Qiu and come from Xinqiao Hospital of Army Medical University, Chongqing, China. I'm very excited to participate in this video interview of International Stroke Conference 2022 to talk about our science with you online. And as we know, it remains uncertain whether intravenous tirofiban is effective and safety for acute ischemic stroke patients with large vessel occlusion undergoing endovascular treatment. We conduct the Rescue BD trial to test the hypothesis that intravenous tirofiban could improve the functional outcomes without increasing symptomatic intracranial hemorrhage or mortality in ischemic stroke patients with proximal large vessel occlusion undergoing endovascular thrombectomy within a 24-hour treatment window. Yes.
All right, thank you. So you mentioned that this trial was really looking at tirofiban in patients with large vessel occlusion. Tell us a little bit more about the inclusion and exclusion criteria in your study population.
Okay, thank you for your question. In this trial, eligible patients were presenting with acute ischemic stroke within 24 hours of time lasting well, NIS score 30 or less, aspect score 6 or more, and occlusions of the intracranial internal carotid artery, the first or second segment of the middle cerebral artery. The key exclusion criteria were dural antiplatelet therapy within 1 week of the index stroke or with intravenous thrombolysis after stroke onset. Yes.
All right, thank you. So it's clear that excluding those patients with thrombolysis helps to avoid the effect of that on the symptomatic hemorrhage and certainly makes sense. What were you able to see with the primary results of this trial?
Okay. Our trial showed that intravenous tirofiban did not significantly improve the functional outcomes among patients with acute ischemic stroke due to anterior circulation large vessel occlusion. However, we observe evidence to support modification of tirofiban treatment effect in patients with large artery atherosclerosis in pre-specified subgroup analysis. In the large artery atherosclerosis stratum, tirofiban was associated with improved functional outcomes, whereas no benefit was found in the non-large artery atherosclerosis stratum. Safety outcomes were not significantly different between the two treatment groups with respect to incidence of symptomatic intracranial hemorrhage and mortality. Yes, thank you.
All right, thank you. Now, given those results in the subgroup with large artery atherosclerosis, do you have any further plans for future research in this realm?
Yes, thank you for your question. Based on the positive findings in the subgroup of large artery atherosclerosis, we are planning to conduct a randomized controlled trial only involving large artery sclerosis patients with large vessel occlusion to investigate the efficacy and safety of intravenous tirofiban before endovascular thrombectomy.
All right. Thank you, Dr. Qiu, for sharing the results of the Rescue BT trial, and congratulations on your presentation here at ISC 2022.
Thank you very much.